struggle and struggle and struggle with CPAP.
Minutes Ago is revealing that getting good sleep can add years to your life. Researchers say the key here is the quality of your sleep. And here's the good news. Apparently, it's never too late to start. So here with what we need to know is Dr. Carol Ash, sleep expert at RWJ Barnabas Health. Dr. Ash, good morning to you.
Good morning.
This is something that certainly grabbed our attention.
Me too.
Yeah, so let's dig in here with this study. So let's talk about the sleep quality factors that help people live longer.
Yeah, it was really fascinating. This was a study that was done by top researchers at Harvard who created this 5-factor score using survey data from the CDC, National Health Statistics, and National Health Statistics and Death Registry.
Okay.
So they linked these 5 factors to mortality and found that you're 30% less likely to die of any cause if you have a positive answer to all 5 questions.
So the sleep obviously so important, but there was a difference between men and women when it came to life expectancy. Do we know why?
Yeah, Tom. I mean, normally we say women are going to live longer than men, but this study showed that if you have all 5 of these factors, that men can actually have a longer lifespan, 2 times more than women, that the outcome showed. So really, really amazing. So sleep really can have a big impact on your health.
And what kinds of health benefits might you get from sleep?
Well, most significantly, this study showed, and we've known for a long time, cardiovascular health. You can also see a reduction in cancer, problems with the immune system. So really profound. But the impact on cardiovascular health was really significant. And one of the reasons we think that may be true is when you don't get good sleep, it increases inflammation and actually may alter the metabolism for lipids, which we all know can cause cardiovascular disease.
You know, there were 5 tips there, but not everyone can do those big 5, right? What if you can only do a couple? Is that still helpful?
They actually showed that if you did a few of them, there was a lowering of the risk. So there was a stepwise benefit from doing 1 or 2. And, naps on the weekends, we all have very, very busy lives and it's hard to do all these things. So naps are good, but you want to keep it no more than 40 minutes. And so, yes, so that's the key.
We're like
Siesta.
guilty faces here.
There are a lot of people who will do 4 hours and then 2 and think, well, I got 6 hours total today.
Correct. I mean, the nature of sleep is you want to do it in
consecutive.
Yes, exactly.
Yeah.
Keep a consistent schedule, and obviously we're all busy. So when you don't do that, you offset it with the naps and good habits. Exercise, diet, all help.
Dr. Ash, thank you so much. And for rolling with the mic problem. Could you do a song from the new album? Yeah, drop the mic, exactly.
Your life? Do you feel embarrassed, isolated, tired of having to constantly reassure others that you're not sick? Have you managed your symptoms with medications and sprays only to have them return? If this all sounds familiar, you may be suffering from chronic rhinitis, a common condition that affects over 30 million people in the U.S. alone. Chronic rhinitis occurs when abnormal nerve signals in the nasal cavity cause inflammation and excessive mucus production, leading to a persistent runny nose, postnasal drip, congestion, coughing, itching, and sneezing. Luckily, there's now a non-invasive treatment for chronic rhinitis that can be performed right in your doctor's office with minimal discomfort. The Rhinair procedure from Erin Medical uses temperature-controlled energy to disrupt those abnormal signals and offer you long-lasting relief with zero downtime. That lasting relief means an improved quality of life and a significantly reduced need for tissues and expensive over-the-counter medications. In fact, a recent survey showed that 96% of Rynair patients experience substantial relief from their chronic rhinitis symptoms. So don't let a runny nose run your life. Ask your doctor if the Rynair procedure from Aaron Medical is right for you.
Vivair is an innovative way to provide your patients with lasting relief from nasal airway obstruction by treating and remodeling all three components of the nasal valve without precluding the possibility of a future nasal surgery. Using temperature-controlled radiofrequency energy, Vivair treats nasal airway obstruction and nasal valve collapse to significantly increase airflow by increasing the radius at the most narrow part of the internal nasal valve. In contrast to alternative treatments, such as surgical intervention, the Vivair procedure is non-invasive, incisionless, and office-friendly. To perform the procedure, apply gel to the tip of the Vivair stylus and insert to treat the caudal edge of the upper lateral cartilage. Apply pressure anterior to the nasal bone and maintain a 4 mm lateral deflection, or about the width of a stylus head. Initiate the 30-second treatment cycle by holding the foot pedal and maintaining lateral deflection. You'll hear the console beep twice after 18 seconds of heating, and again after 12 seconds of cooling. Continue along the treatment zone of the upper lateral cartilage, being careful not to overlap treatments. Apply treatment if needed to the inferior turbinate and septal swell body, applying mild pressure to the head of the inferior turbinate to treat hypertrophy, and to the septal swell bodies along the anterior portion of the septum. After being treated with Vivair, patients reported significant improvement in nasal breathing, sleep quality, and other quality of life measures through 2 years post-treatment. Connect with us today to learn how to bring Vivair into your practice.
Sinuses are a series of interconnected hollow spaces in the skull. Their walls are lined with mucus-secreting membranes. Small hairs sweep the mucus out of the sinuses so it can drain out through your nose. These mucous membranes may become infected or inflamed because of a cold or allergies and can swell up and block the nasal passages so that the fluid from the sinuses can't drain. Buildup of fluid in the sinuses causes pressure and pain. Doctors call this sinusitis. Acute sinusitis comes on quickly and then leaves. With chronic sinusitis, people have symptoms virtually all the time and take many courses of medications such as antibiotics to treat the inflammation. Severe sinusitis may require surgical opening of the passageways with rigid steel instruments placed up through the nostril to remove bone and tissue blocking the drainage. Recently, a new less invasive technology called balloon sinuplasty has been introduced. Using this technology, a balloon catheter is delivered to the blocked passageway and is gently inflated, widening the opening of the passageway and thus allowing drainage and relief from the pain and pressure.
just spring. Grass growing, flowers blooming, trees growing new leaves. But if you get allergies, this explosion of new life probably inspires more dread than joy. Step outside, and within minutes, you're sneezing and congested. Your nose is running, your eyes are swollen and watery, your throat is itchy. For you and millions of others, it's seasonal allergy time. So what's behind this onslaught of mucus? The answer lies within you. It's your immune system. Seasonal allergies, also called hay fever or allergic rhinitis, are a hypersensitive immune response to something that's not actually harmful. Pollen from trees and grass and mold spores from tiny fungi find their way into your mucous membranes, and your body attacks these innocuous travelers the same way it would infectious bacteria. The immune system has a memory. When a foreign substance gets tagged as threatening, white blood cells produce customized antibodies that will recognize the offender the next time around. They then promptly recruit the body's defense team. But sometimes the immune system accidentally discriminates against harmless substances, like pollen. When it wafts in again, antibodies on the surface of white blood cells recognize it and latch on. This triggers the cell to release inflammatory chemicals, like histamine, which stimulate nerve cells and cause blood vessels in the mucous membranes to swell and leak fluid. In other words, itchiness, sneezing, congestion, and a runny nose. Allergies usually, but not always, show up for the first time during childhood. But why do some people get allergies and others don't? Allergies tend to run in families, so genetics may be one culprit. In fact, errors in a gene that helps regulate the immune system are associated with higher rates of allergies. The environment you grow up in matters too. Being exposed to an allergen as a baby makes you less likely to actually develop an allergy to it. People who grow up on farms, in big families, and in the developing world also tend to have fewer allergies. Although there are plenty of exceptions, partly thanks to genetics. One theory is that as children, they encounter more of the microbes and parasites that co-evolved with traditional hunter-gatherer societies. Called the hygiene hypothesis, the idea is that when the immune system isn't exposed to the familiar cast of microbes, it'll keep itself busy mounting defenses against harmless substances, like pollen. Another theory is that an immune system toughened up by a barrage of pathogens is less likely to overreact to allergens. Pollen is a common offender just because we encounter so much of it. But there's a long list of substances: dust, animal dander, insect venom, medications, certain foods that can send your immune system into overdrive. Some of these reactions can be scary. An allergy can develop into full-blown anaphylaxis, which typically brings on severe swelling, shortness of breath, and very low blood pressure. It can be deadly. The body can even have an allergic reaction to itself, causing autoimmune disorders like multiple sclerosis, lupus, and type 1 diabetes. But even non-life-threatening allergy symptoms can make you miserable. So what can you do about it? Medications can help reduce the symptoms. The most common ones keep histamines from binding to your cells. These antihistamines stop the inflammation response. Steroids can help dial down the immune system. Another more permanent option is immunotherapy, deliberate, controlled exposure to gradually increasing amounts of an allergen can teach the immune system that it isn't dangerous after all. And if you're really adventurous, there's a less traditional option: intestinal parasites. When hookworms sink their teeth into the intestinal wall, they secrete chemicals that blunt the immune system. Some studies suggest that hookworms can treat allergies, which may be another reason allergies are more common in industrialized countries, where hookworms are few and far between. Of course, you can always just wait your seasonal allergies out. The spring pollen onslaught dwindles by midsummer, just in time for ragweed season.
From Washington, D.C. this morning because, man, we sure do have a sweet buddy up.
That's right. I know you guys know the answer to this. What can soothe your sore throat, boost energy, and make tea taste oh so good?
Ooh, I wonder.
Oh, well, it's honey. And honey, it wouldn't be possible without those hardworking bees and their keepers. We learned what the buzz is all about when the four of us got to visit a rooftop bee farm. This is it, the bee's knees. We got Nick Heffley of Astor Apiaries here, and he's going to take us upstairs to show us some of his hives. The excitement was buzzing as we made our way to Nick's rooftop hives and suited up.
Very graceful.
Dylan, I am your father.
First, the master beekeeper sharing some fast facts to get us up to speed.
In this one hive, there are about 30,000 bees.
Wow. No, the bees are your friends.
They're your friends. They all have jobs to do, and those do not include checking us out.
Turns out they're all kind of busy workers.
We have foragers in here. We have house bees in here.
With all sorts of tasks in and out of their home.
There are guard bees. There are mortician bees. When they first emerge, they're a cleaner bee, and then eventually they'll become foragers once they get old enough.
Are the foragers only female bees?
All the worker bees are female bees. So 95% of the hive, and in some hives, 100% of the hive will be female.
While female bees are able to take on any one of the 8 available hive chores, male or drone bees have precisely one job: to mate with a queen from a different colony so she can return to lay more eggs, about 2,000 a day.
Right now, we have a lot of confused bees as well. And they're just trying to figure out why there's so many new landmarks around their hive.
Yeah. They're like, is that a roker? Oh my God.
All right, so we're gonna pull out a couple frames here.
Oh, this is awesome.
This seems like it would annoy them.
It's something that we want to do slowly.
How would you characterize the state of the bee population right now in our country?
The bee population, as far as managed hives, is actually not falling as much as everybody thinks it is.
Mm-hmm.
There's a lot of concern more on native pollinators and those unmanaged bees.
I see. Wow, look at that.
Soon, it was Craig's turn to handle the frames,
They're a little annoyed with me. Kind of like you guys.
while Nick helped us spot the monarch.
Now, what were you saying she's doing there?
She's walking around right now looking for cells to lay eggs in.
So humble. I'd be on the throne. I'd let them do all the work. She does walk around like she's the queen bee.
Right now, the queen is exposed, so they're getting around her to keep her nice and warm.
That's crazy.
God save the queen.
After tucking the bees back in, Nick treating us to a tour tradition.
This is how the bees leave it when we're ready to harvest. So what you can do is you can just press your finger right into it, and you can try some of the honey direct from the hive.
That's great. That's the
like
purest honey we've ever had.
Oh my God. That's just honey.
Nothing but
That
honey.
is.
That's about as fresh as it gets.
All right. But we wanted to see how honey gets from the comb to our home. So we headed to Nick's shop, the Honey House at Astor Apiaries.
We're going to do a little honey harvesting. The first thing that we've got to do is we've actually got to remove all of the cappings here. Now that all the honey is exposed, we can actually take this to our extractor.
Oh,
that's where the magic happens in separating everything.
Craig got to flip the extractor switch. Of course he did.
We'll just turn this dial up to about 30.
Are you sure you're ready?
Oh,
Here it goes.
So this is like a honey tilt-a-whirl.
And that's the honey right there. Okay, with this jar.
After all our hard work, we treated ourselves to a snack break.
What you just got is actually also a bit of a spicy salami, sweet and spicy.
Oh, wow.
Before jarring some honey to take home.
1.5 million visits of a bee to make that amount of honey.
That was one busy bee.
Cheers. Cheers to honey.
To honey.
To the sweetest story and buddy up we've ever done.
Oh,
All right.
We learned so much.
I was fascinated.
It really was, and what was just it was like literally from hive to home to watch all that going on. Hive to home. And we want to thank Big Nick. Oh, you guys have some honey there too.
We got some goodies.
Delicious.
I'll put a jar in your dressing room.
Yeah.
Well, thank you very much. And in fact, we've got Rosh Hashanah coming up.
Oh, yeah.
And that's part of that the tradition of
Apples
honey,
with honey.
Apples
and
with
apples.
honey.
Yeah, Rosh
Very
Hashanah
nice.
starts tomorrow, the Jewish Happy New Year.
Happy New Year. That's a sweet way to celebrate. We want to thank Big Nick and all the folks involved with Astor Apiaries and the National Honey Board for their resources. They're doing important work.
Absolutely.
Because on average, there is a 40% bee loss in nature, impacting things like pests, hive disease, climate change. And I shared this one fact with you guys.
Okay.
You know, we see all those honey jars that are shaped like bears or with Winnie the Pooh.
Yeah.
We think bears like honey. They actually are going after the bee larva. And the honey just is a byproduct. They're not interested in the honey. They want the bee larva to get the protein.
So it's just a legend that he likes.
So they don't need to carry that big thing around that says honey on it.
No, he does, but it's spelled Hunny for Winnie the Pooh.
Well, of course.
There you go.
But of course. But in all sincerity, like I really have greater respect for bees and how we need them and natural honey. Oh my goodness, there's just nothing like it.
So delicious.
Thank you, Al. Safe travels back.
Great. And congratulations again, Al.
Thank you very much, guys. See you tomorrow.
All right.